Ladies and gentlemen, thank you for standing by and welcome to the COVID-19 media briefing. At this time, all participants are in a listen-only mode. After the speaker's presentation, there will be a question and answer session. And to ask a question, you will need to press star one on your telephone keypad. Please be advised that today's conference is being recorded. If you require any further assistance, please press star zero. I would now like to hand the conference over to your first speaker for today, Mr. Michael Schumer. Please go ahead, sir. Thank you.
Thank you for joining us for the COVID-19 media call for August 14th. We'll start today's call with a quick situation report from Infectious Disease Director Kris Ehresmann. We'll then hear some comments from State Epidemiologist Dr. Ruth Lynfield. After those updates, we'll open it up for questions from reporters on the line. With that, I'll now turn it over to Kris Ehresmann.
Thank you, Mike. So as of this morning, the global total for COVID-19 was above 20.9 million cases with 760,000 deaths. And in the United States, we were at more than 5.2 million cases and 167,000 deaths. We increased by 738 cases from yesterday for a new total of 63,723 cases in Minnesota. The median age of our cases is 36 years old. And that has remained constant for the last number of days. The new total of deaths in Minnesota is 1,693, up 8 from yesterday. 6 of these deaths occurred in residents of long-term care facilities. 3 were in Hennepin County, 2 in Nobles County, and 1 each in Blue Earth, Cass, and Watonwan counties. The total includes 1 person in their 90s, 3 in their 80s, 2 in their 70s, and 2 in their 60s. There are currently 313 patients hospitalized with 152 in intensive care. I'd like to talk today about a couple of things as we look forward to and plan for fall. As we get closer to the start of the school year for K-12 and higher education, we've been in ongoing conversations with the Minnesota Department of Education, school districts, college administrators, and of course school nurses. One key point we keep hearing from these school officials ties into the same issue we've mentioned on calls recently. And that is the connection between what individual Minnesotans choose to do or not do to slow COVID spread and the impact that will have on our communities and especially on our schools this fall. School nurses have stressed this point to us. Everyone, students, teachers, and school community needs to do their part to slow the spread of COVID if we want to give our students a reasonable chance to continue in-person learning in any form this fall. That means socially distancing, wearing masks when in public, and staying home when sick or exposed to COVID. We have a special message for students heading to a college campus this fall. Lay low before you go. I was a college student a long time ago, and I've been the mother of college students, and I know how difficult this guidance can be. And I know that I sound like a mom when I'm saying it, but I am a mom, and I do care about the outcomes for our students. Before coming back to campus, plan to stay home and interact only with the people you live with for at least 14 days if you have that much time before school starts. If you have been exposed to COVID-19 and don't know it, this will ensure you don't spread it when you return to campus. I know there are a lot of opportunities and temptations during the summer for social gatherings and parties, but if you want to be able to go to college or the university and have your school remain operating in person, you have a big part to play. Some students have been careful and followed precautions, and some have been less diligent about it, especially over the summer. No matter what you've been doing up to this point, now is a very important time to start reducing any activities that carry a heightened risk of transmission. That means skipping the massive house party, avoiding the crowded bars, and limiting your interactions. We recently added some specific information to our website with guidance for higher education students. It can be found on our website at www.ksd.edu. health.state.mn.us. Really, for all students and families of students, as we head toward the school year, we need you to help give schools a better chance of starting off the school year on a good note by doing your part to reduce COVID transmission. It's frustrating to note that despite all our warnings to this point, our epidemiologists continue to hear of big house parties and other settings associated with COVID spread. We need to be clear that as we get close to within a couple weeks of schools opening, this is a bad time to throw a party, go on a group road trip, or otherwise lighten up on COVID precautions. We're in a tough time right now when people are eager to return to the school sports and activities so many of us enjoy. But we need to realize that the pandemic is still a big problem, and it will likely become a bigger problem as we head into fall. If you want to return to in-person learning, then some extracurricular activities, sports, band, choir, field trips are going to be difficult to offer, at least in the same way we're used to seeing them. We know that school nurses and other school officials are getting lots of pressure from well-intentioned parents and others in their communities to allow some extracurricular activities to continue as they always have. And I understand why you'd like to have that happen. This is normal and completely understandable, but we need to temper it with the realization that we're in a pandemic. The virus is active in our communities, and we need to realize the world has changed and won't be going back to normal for at least the next few months. Please be kind to your school officials and especially those school nurses. They are trying to do their best in a very hard situation, and they are trying to protect students. On a related note, we wanted to pass along the reminder about the importance of self-isolating during the time between when you get a COVID test and when you get the results. This is especially important if you're a healthcare worker or a child care worker or a long-term care worker, or if you have any contact with large groups of people, especially groups of high-risk people. Our epidemiologists have been noticing a number of incidents in which COVID transmission happened when someone got a test but then went out to their job or otherwise was out and about in the community before they got their test result. If you're getting tested, that means that you think that there is a reason or a reasonable likelihood that you may have COVID. And so it's really important that you stay home. It's tempting to say, oh, I'm just going to go out anyway, especially if you're feeling okay. But keep in mind that that decision can hurt the community and make the outbreak bigger for all of us. And with that, I will turn it over to Dr. Ruth Lynfield.
Thank you, Kris. I wanted to speak with you today about hand sanitizers that contain methanol or 1-propanol. Earlier this week, the Food and Drug Administration sent out another warning. They've sent out a few over the past few months to consumers and healthcare professionals about certain hand sanitizer products. There have been warnings about products containing methanol, and the warning this week was about products containing 1-propanol. Neither of these, 1-propanol or methanol, is an acceptable ingredient for hand sanitizer products marketed in the United States. These can be toxic and life-threatening when ingested. FDA urges consumers not to use these contaminated products and has a list of hand sanitizers to avoid at www.fda.gov/unsafe hand sanitizers, all one word. Symptoms of 1-propanol exposure can include confusion, decreased consciousness, and slowed pulse and breathing. Skin or eye exposure to this compound can result in irritation, and rare cases of allergic skin reactions have also been reported. Ingesting methanol-contaminated products can cause central nervous system problems that can result in death. Symptoms can include nausea, vomiting, headache, blurred vision, permanent blindness, seizures, and coma. Anyone who has been exposed to hand sanitizer containing 1-isopropanol or methanol and is experiencing symptoms should seek immediate care for treatment. Consumers who have products on the list of hand sanitizers with potential contamination due to these products should immediately stop using them and dispose of them in a hazardous waste container. Do not pour them down the drain or flush them. In Minnesota, our Poison Center has received 50 calls related to methanol in hand sanitizer products. Of the 50 calls, 8 were individuals who sought medical care and were released. 14 of the 50 cases were in kids who were 19 years of age or under. 8 of those were in kids under 6. And most of these involved ingestion of a hand sanitizer. We are not aware of any deaths in Minnesota, and we hope that continues to be the case. However, CDC released an MMWR this week on 15 cases. These were adults aged 21 to 65 who had methanol poisoning from alcohol-based hand sanitizers in Arizona and in New Mexico. 4 patients died. 3 were discharged with visual impairment. So our recommendations to the public are to wash their hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, after coughing, sneezing, or blowing one's nose. If soap and water are not readily available, CDC recommends use of an alcohol-based sanitizer that contains at least 60% ethanol, referred to as ethyl alcohol, or 70% or more of isopropyl alcohol. Again, not methanol, not 1-propanol. Hand sanitizers should never be swallowed, and children using hand sanitizers should be supervised and hand sanitizers kept out of their reach. I will return the call now to Mike. Thank you.
Thank you, Dr. Lynfield. Operator, we are now ready to take questions.
All right. As a reminder to our audio attendees, Q&A is now open. To ask a question, simply press star 1 on your telephone keypad. To withdraw your question, simply press the pound key. And our first question for today is from Kris Megan of Pioneer Press. Your line is now open.
Hi, thanks. I wanted to ask a little bit about testing. Noticed that there was sort of a significant lull in results earlier in the week, and I've also heard from some readers that there's a lot of pre-screening going on and other things. Are we experiencing any type of slowdown in testing availability in Minnesota?
This is Kris Ehresmann. I would say that there had been some delays with testing and turnaround time, and we know that there have been, some health systems that have had some challenges getting some of their supplies. And so they are making sure that they are screening people, but the Department of Health has put up our guidance on who should be prioritized for testing, and certainly, anyone who is asymptomatic falls to the top of that list. I'm not sure if those are the people that have been reaching out to you, but they are certainly the priority that we have for testing.
But no, do you have any idea what the time frame for test turnaround is right now? Or anything to explain the kind of decline on Monday, Tuesday, Wednesday this week?
Well, certainly we always know that we see fewer test results on Mondays and Tuesdays just simply because there's less testing that occurs over the weekend. And so that is a very typical decline. In terms of the turnaround time, what we know is that if a test has been sent to a national lab, that can result in a fairly long turnaround time, much longer just simply because they're processing specimens from across the country. We know that Mayo had some delays for a while, but they are back on with their, expected, 48, 72-hour turnaround. So, that's the information that we have at this point related to testing.
Thanks.
Next question is from Peter Cox of Minnesota Public Radio. Your line is now open.
Yes, I'm wondering if there are any signs that the mask mandate is having an effect. And second question is just an update on long-term care. Thanks.
Sure. At this point, our case numbers have stayed fairly consistent. We haven't seen significant reductions in case numbers over the last couple of weeks. And so, it's really challenging to comment on that. We are aware of a number of situations and a number of settings in which we've been made aware of lots of transmission, and these are settings in which people weren't following guidance and weren't wearing masks. And so that also is challenging because obviously we have a mandate, but it's dependent on people following that mandate in all settings. And so that makes it tough to be able to comment on whether or not the case numbers that we're seeing are being impacted. I'll see if Dr. Lynfield wants to comment, and then I'll get you some updated numbers on long-term care.
No, I agree with what Kris said. It also is the case, we are over the past couple of months, we've been increasing. And so it is possible that more people wearing masks is resulting in cases that might have continued to go up. Maybe we're stabilizing a little bit. But it isn't just the mask. It's wearing the mask appropriately. It is also keeping a social distance. Wearing a mask doesn't totally cover everything. We know that it's important to maintain that social distance. And we also know that some of the situations where we've seen a lot of cases in bars, restaurants, graduation parties have been in settings where people have not been wearing masks, as Kris has said.
And then I'll just comment on where we're at with long-term care. We currently have 1,493 long-term care facilities that have cases, and 640 of those facilities have just a single case. 233 have 2 cases, and 556 have more than 2 cases. But I think it's important to keep in mind that as we're describing outbreaks in these facilities, that many of them, so that gives you the sum total for the duration of the outbreak, but for many of them, they are at a point where they have had over 28 days since the last resident case at the facility, or the last time that a staff person who was infectious was at the facility. And so that means that their outbreak is quote unquote over. So the 1,493 is the cumulative total number of cases, or of facilities who've had a case. But at this point, we have a number of facilities who have not had a case in the last 28 days. And so that 67% of the facilities have not had a case in the last 28 days. And so that's a significant number. So I think even as we're talking about the cases that we're seeing, we want to acknowledge that a number of facilities have gotten the situation under control and have not seen cases for 2 incubation periods.
Thank you.
Next question is from Bill Werner of Minnesota News. Your line is now open.
Hi, thank you for taking the call. Kris, I think this one is probably for you, and what prompts it is the political situation, but it's actually a more of a health-related question. There's going to be focus on Minnesota and Wisconsin early next week with presidential visits and the opening of the Democratic National Convention and so on. And I suspect that in that rhetorical exchange there are going to be references to Minnesota and Wisconsin and the number of COVID cases in each state. That let's see, Minnesota's current number is about 1,700, just shy of 1,700, and Wisconsin is about 1,100, as I recall. And I know this question has been asked before, but I'll ask it at this juncture. Why do you think there's a difference? Those two states are similar in population. They're fairly similar in demographics and in geographic location. And the political arguments I might ask you to address. But why do you think the difference between the two?
Okay, I'll start and certainly ask Ruth to jump in too. One thing that has really driven the number of deaths that we have recorded in Minnesota was our early emphasis on testing and identifying every case we could in a long-term care setting. And so I do think that has made a difference in contributing to the larger number of cases. We've done some aggressive testing in those facilities, and so by identifying, as many cases as we can, that means that we will be more likely to count deaths when they occur as related to COVID. So that is a factor. Having said that, however, it's challenging to say what might be different. I mean, we've certainly talked to the folks in Wisconsin and have not identified significant differences in how we're responding to the outbreak. However, I'll let Ruth comment as well.
May I just interject for a second, though? However, Wisconsin, in terms of response, they've been running wide open pretty much under court orders, whereas Minnesota's in quite a bit different position.
Well, I think it's important to note that when the court struck down some of the guidance that had been put forward by the governor, that many of the large jurisdictions chose to take matters into their own hands. So municipalities put in more restrictive guidance and measures. So it's not quite fair to say that the state has been open. The large cities did put in more restrictive guidance, and so that may have made things more similar than it might have seemed.
I appreciate you clarifying that. Thank you. Mm-hmm.
Yep, and Ruth, do you want to make a comment?
Sure. I will just make a comment, which is that we are doing, in terms of statistics, we have higher rates of death than some of our neighboring states, and we have lower rates than others. So, for example, Michigan has had 6,219 deaths reported at a rate of 62.3 per 100,000, with a case fatality rate of 7.4%. And Minnesota, our deaths per 100,000 is on the order of 28.7, with a case fatality rate of 2.8%. Illinois has had 7,723 deaths reported, with a rate of 60.9 deaths per 100,000 and a case fatality rate of 4.2%. So you see there are some fluctuations amongst our states. Some of this has to do with which populations have infection being transmitted. Some of it has to do with what Kris alluded to, with how aggressively are you trying to look for SARS-CoV-2 in long-term care facility residents, for example, who die. And so just to keep it in perspective, this is also a pandemic that has gone on for a long time and will continue to go on for a long time. And so there will be fluctuations as different states experience the outbreaks occurring in different populations, and they're trying to control it in different populations. And so you will see changes over time. Thank you.
Dr. Lynfield, would you mind giving us the numbers for Wisconsin also? You gave us...
oh, of course.
In Michigan. That would be helpful. Thank you.
Of course. So the rate for Wisconsin is 16.3 deaths per 100,000 and a case fatality of 1.7%. And again, these are deaths that have been identified as being due to SARS-CoV-2.
Thank you very much.
Next question is from Steve Karnowski of Associated Press. Your line is now open.
Yeah, hi, thanks for taking my question here. Just getting back to the guidance on colleges, are there any colleges that you're specifically worried about at this point? Any because maybe they have a reputation as a party school, or places where you're already seeing outbreaks connected with bars near their campuses, anything like that?
Well, that's a good question. Certainly, when we started to see outbreaks associated with bars this summer, we did see them follow locations where we know that there are colleges and universities, and so we're certainly concerned. We don't want to see that activity continue, but by the same token, I think that college students across the board all need, there's not a particular area or a particular location, that we're worried about. We want college students across the state to be considering that they really need to think about the actions that they take and the choices that they make to perhaps not follow masking guidance or social distancing guidance could have a dramatic impact on whether or not their college or university is able to continue with an in-person learning mode. And I think that, everyone wants to have the opportunity for as much safe interaction as possible. But if we're seeing a lot of cases because people are disregarding the guidance, then that's going to mean that, these institutions are going to be forced to make some difficult decisions, which may include, moving away from any sort of in-person and on-campus learning.
By your reference there to some outbreaks earlier this summer, we're talking about certain bars in Minneapolis, Mankato, and St. Cloud, right? Any others that I'm missing?
Oh, we saw cases. We've seen associations with bars and restaurants, many locations, but Mankato, Minneapolis, Duluth, Bemidji, St. Cloud. So lots of locations where we know that there are, colleges, universities, and or individuals of the age that students would be.
Thank you.
Next question is from Jeremy Olson of the Star Tribune. Your line is now open.
Hi, two questions. One is just, these college students, it's not like they're going into the basketball, professional basketball bubble or something when they go to college, so that if they don't come in with the virus, they're not going to bring the virus in. Once they go to college, they're going to be going on campus, off campus, they're going to be all over the place. Does this kind of 14-day stay-at-home advice that you're offering, does it really have a chance to reduce transmission on campuses, given how mobile students are once they get there?
Well, we're hoping that when students get to college, that the institution will have guidance for them on expectations. And not every college setting is such that people are, on and off campus readily. So our goal is to minimize what's being brought onto campus. And then once students are on campus, we've provided a lot of guidance. We've worked with the Office of Higher Ed, and we've worked with various secondary institutions on what steps they should be taking to ensure that they minimize the amount of transmission that can occur on the campus. So we're trying to minimize what comes onto campus, and then we've provided guidance for institutes of higher education once students are there to minimize transmission. But the bottom line is students will really decide how successful this is, and students will decide whether or not they have to close down and send everybody home again. That's really going to be dependent on the choices that they make to minimize transmission.
Follow-up question. Have we kind of slammed home the conclusion that virus transmission isn't as prevalent outdoors? I mean, with the number of activities in Minnesota that haven't resulted in widespread outdoor activities that haven't resulted in widespread transmission of the virus, I wonder if that offers guidance for college students that, if they're going to meet outdoors, that kind of thing?
Oh, absolutely. We've certainly said that, being outdoors is a much more ideal setting for any sort of socially distanced interaction than being indoors. So absolutely, that if you're getting together, do it outdoors and make sure that you're staying, 6 feet apart. I think the challenge is going to come when we get out of Minnesota summer and pleasant fall and into much colder weather. Then we're going to have challenges with the fact that we aren't going to be able to be, outside as much as possible.
By the way, just double checking, this guidance was for colleges only? I mean, would you ask K-12 students to stay home for 2 weeks before going to their schools, or is this only for college?
Well, we actually, in my comments, I did also talk about the fact that as all of us are preparing for fall and returning to gathering, that this is a time to lay low, particularly for college students because they're obviously that much more independent. There are more parties, there's more social activities, but it's also true for high school students as well.
Thank you.
Next question is from Paul Bloom of Fox News or Fox 9 News. Your line is now open.
Hey, thanks for taking the call. Question, kind of following up on the mask mandate that was asked about earlier in this phone call. Hopefully you might have some numbers. I just happened to be doing a story today on a state business that received a cease and desist notice from MDH. And I'm just wondering how many cease and desist orders have gone out to businesses that refuse or don't want to comply with mask mandates or perhaps the social distancing rules that your inspectors are looking for, and they have been told that the case has been turned over to the Attorney General's office perhaps for some enforcement action. And I'm just wondering if you could refresh us on the process by how a case ends up over in the Attorney General's office for violations of the emergency orders. Thank you.
I can give you an overview of kind of how the process works. I don't have the exact numbers right now, and I will check to see if we can get that for you, even as we're talking here. And so we can't talk about any specific enforcement activity while it's in process, but I can say broadly that state officials have a responsibility to fairly and consistently uphold the protective policies implemented to reduce transmission of disease. So that is, as you mentioned, for instance, the masking order. Our goal is always to first try to work with the parties to help them come into compliance. So, talk through the situation, hear their perspective, explain in greater detail why the specific policy is in place. But we do have a responsibility to all Minnesotans not to allow willful violators to disregard or endanger the health of their employees, neighbors, or community members. So we will work with people to help them come into compliance. That's the first step that we take. Our first step is to be helpful, not regulatory enforcing, but we do have an obligation to make sure that people aren't willfully violating policies that put their employees, neighbors, and community members in danger. So, as I said, our goal is to really want to help people come into compliance. But what we found is that in some situations, this supportive approach doesn't result in the necessary compliance. And so in those cases, we do have to make a referral for further follow-up. So just as food safety requirements are not optional, these COVID safety requirements are not optional. And most Minnesotans expect us to enforce these requirements and to keep them, the citizens, as safe as possible. And so that's what we do. And I will be checking here to see if I can get you additional information on the number of enforcement actions. Thank you.
Yeah, and thank you for answering. I had asked your PR team off the call about those numbers, so I'll wait for those. And then their position has been quote unquote freedom of choice, or a small coffee shop, breakfast shop. Basically that people can choose to come in or not. But I suppose your reaction would be you're protecting everybody within that building, employees and everybody else, and that argument would fall on deaf ears with MDH.
Right. I mean, we certainly be willing to have a conversation, but yes, our legal role is to ensure that we're protecting the health of Minnesotans, and in these specific situations that we are enforcing these requirements. And so, yes, that's where we're coming from.
Operator, we have time for one more question.
All right. Okay, the last question is from Greta Cole of Minnesota Post. Your line is now open.
Hi there. I was wondering, you talked, I think, a couple weeks ago about a person testing positive after attending the Stampede Rodeo in Effie. Were there any subsequent cases that were identified as exposures from that event?
Yes, we did have one additional case that I've been made aware of. So additional case in an individual who attended the rodeo. And I'll double check to make sure that there haven't been any more. We can let you know.
Thank you.
All right, that is all the time we have for the call this afternoon. If you had a question we were not able to get to, please feel free to reach out to our office this afternoon. Have a good day, and we'll be back again with you on Monday.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. Enjoy the rest of your day. Keep safe, and you may now disconnect. 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 You may now disconnect.